Hello, NCM 102 class or students. So today we'll be discussing the topic on health education team. So our goal or our learning outcomes after my lecture is for us to understand deeply and identify the different roles of nurses in health education team. And here we will also determine the important role of of other members of health education team, which we will be identifying later who are those included in the team. We identify the values and principles for a health team or for the health education team to work well, and we will be able to appreciate the importance of the role of family members in health education process. So to begin with, one of the very important role of a nurse is to give information or giver of information. So when do we perform this or when do we actualize this? No, so given a situation wherein a patient is unaware of a potential harm or adverse effects or the benefit of the medication, or even their relatives, no, or family members who are not really knowledgeable on the potential effects of a particular treatment or a medication. So this is where we could give them insights, no, valuable education insights as to telling them the information that they will be needing. Now let's say, for example, a patient who would go for a COVID-19 vaccine, no? So we will tend to tell them what are the side effects, what are the potential side effects of that drug or medication. Giving them information is very vital for their cooperation. That's why during vaccination, as you have observed, I know you've also went through the same process. There's the counseling team who will tell you of the potential side effect and what you should do if there would be those common signs and symptoms like swelling, no, chills and fever when you go home. So another thing, for example, your patient or family member, or should I say the patient is a diabetic patient. So with me here is an insulin pen. So they are not aware of how to utilize this at home because doctors would prescribe this for the patient to bring at home. So how would you give information with regards to the insulin pen? So you will teach them how to use this by clicking the numbers here, and then you would select how many units the patient's prescribed medication is. You get the first cap, you remove the last cap, and the needle will be there, and then you have to do it 90 degrees. Since the needle is short, you can give it 90 degrees because you are giving it subcutaneously in the abdomen, 2 inches away from the navel, and then you then press the insulin pen. So that's how you give information to your client. So you provide information in terms patients and family members can truly understand. So avoid jargons or terms, medical terms that they cannot really relate to. No, so if you'd say, okay, ma'am, you will go to our laboratory tomorrow morning for your lipid profile blood extraction. So if you'd say that, and then you instruct them that NPO post midnight. So if you say NPO post midnight, your patient or the relatives may not be able to understand what's NPO. That's nothing per orem. Even if you tell them nothing per orem, they will still not understand that. So what we do as a nurse, we have to simplify it using layman's terms. So you would say nothing by mouth after 12 midnight. So by using those kind of words or terms, your patient or your relatives or the relatives of the patient will truly understand what you're trying to say. Use teach back and show back, in which patient or family member could restate information provided by the nurse or any clinicians or any health team, or display new taught skills to increase understanding and decrease confusion. The very basic example is the insulin pen that I gave as an example earlier. So you can teach it to them and you will tell them, okay, ma'am, can you do it for me? Show it to me if you truly understand my instructions. So can you demonstrate it to me? So the patient will demonstrate it to you and then will show back the procedure, no? The newly taught skills that they will be doing at home without your assistance anymore. So a facilitator of learning. So another role of a nurse is to be a facilitator of the health education. So based on this slide, no, so the conversation of a nurse to, or should I say, the conversion of a nurse to a facilitator of learning means you switch from content transmitter to process manager. So meaning nurse can convert traditional method of instruction into facilitator mode of teaching and learning. So rather than going to the traditional manner of just keep on talking, you are the ones giving out primary information. If you will be a facilitator, you will just be guiding the patient all throughout the health education process, meaning you'll also be listening to the feedback, no, to the feedback of the patient, and you will also be evaluating the improvements, no, of the patient performance in terms of your education. So you have to assess the need for and to develop and manage and coordinate programs of clinical education for patients. So if you were able to see or evaluate there is a need for an nurse or a education program for the patient, then you have to establish and facilitate that for the patient. So you have to assess properly if there's a what deficiency in terms of knowledge, so you can create a schedule of meeting, a schedule to, for example, the patient is a diabetic patient and she doesn't know how to do his or her diet or how to prepare, then you can coordinate and facilitate the health education process to the dietitian because of the identified concern in terms of food preparation for a diabetic patient, because that's a special food preparation that we have to do. Clinical education facilitators are responsible for the selection and organization of training. So you will be the one to set a schedule, the venue, the appropriate person that the patient would be able to speak to address his or her concern, help the learner or patient become aware of what he needs to know and the value of why do you have to teach them this kind of topic, and the opportunity to open discussion among the health team members. So through that, no, you will be the vessel, you will be the facilitator of the whole process of giving out appropriate education to your client. So what are the qualities of a facilitator? You must be a good communicator. You have the questioning skills, no? So you have to ask questions so that you can derive to a very good evaluation and assessment on what really are the health needs of your client. You should be somebody who would be very guiding to your patient, no? So that your patient would cooperate also. Conflict management, so you should be should how to settle things, no, especially if you will be assessing patients and also the family members. You may be able to encounter conflicts between them or to other health providers, so you must be able to address and know the process of conflict management. Leadership, so you'll be the ones who will be again leading the whole education process. So you will be coordinating well, you will be the ones who will be you will be the one who will be organizing the whole process of teaching, learning, education process. So you will act as a leader, no? So self-awareness, make sure that you're aware of yourself, you know your strength and your weaknesses before you talk to the patient and before you teach them. So you must be fully aware of your competencies, your skills also as a provider of education or learning. You must be approachable. So you must be somebody who is not intimidating so that your client will be what will open up to you. Empathetic, meaning you have to put yourself in the shoe of others, meaning you have to feel what your clients are experiencing so that you would also appreciate your status right now and you would really understand the suffering, the pain, the happiness of your client. So there must be empathy, sensitive to the needs of your clients. So you must be able to detect if they are sad, happy, anxious, or if they have understood something. Then you must be sensitive on their feelings and their needs, being able to negotiate. So if there are conflicts in schedules, if there are things that are not going based on your plan. So you have to negotiate it properly, meaning you have a good communication skills in order for you to organize the whole education process for your patient. So the role of a facilitator is to provide structure for learning. So meaning what would be your method, what would be your materials that you'll be using. You provide a structure, guide the learners well, identify the learning resources that you'll be needing. Will you be needing a PowerPoint? Will you be needing a handouts for this? Or will you be needing an actual insulin pen for you to teach this to your patient? Encourage cultural competence by exposing the learners to clients in diverse settings. So you have to, again, understand the language barriers, no, cultural beliefs. So you must be able to appreciate and find creativity in terms of how you will deal with the differences in culture. Okay, so motivate learners. So if there are learners who are like passive or depressed or anxious, so you must be able to bring out the positivity from them, bring out the life, the hope, especially for those patients who are suffering from a chronic illness, no, like dialysis patients or watchers who has a patient who's having dialysis, no. Support them in theoretical and clinical settings and act as a role model. So if you say do not smoke, so make sure you as a facilitator and a caregiver should not also smoke. Okay, coordinator. So a nurse also is a coordinator of teaching. So nurses are responsible for ensuring that patients are able to understand their health, illnesses, medications, and treatments to the best of their ability. And a nurse should take the time to explain to the patient and their family or caregiver what to do and what to expect when they leave or after they will be discharged from the hospital. So meaning we have to make sure that the patient is confident or who is aware, knowledgeable on where will they seek additional information or support after they will be discharged. A classic example is, for example, me as a first-time parent. No, I just delivered my baby. So it is very important to educate the mother on what community can I tap, can I go to if I have questions in breastfeeding, if I have questions about how to care for my infant, no, because it's really stressful for a first-time mom to take care of the baby. Even if I'm a nurse, I still need experts, no, to help me out because breastfeeding is really a struggle if you'll be the first time mom, like your nipples are sore, it's very painful, you don't have enough sleep yet, and then your baby is already agitated crying, and then you as a mother, you will be depressed and wow, and then I don't have enough milk. That was my experience. Actually, I don't have enough milk. Who can advise me, or what are the community group that I can seek to, no? So that's something that you should have coordinated prior the discharge of the patient. So you can say, okay, ma'am, we do have the Alima, we have a community outside which you can tap, no? So I was very lucky to have enrolled myself in parenthood community. There's a page on that, so I also joined, and that is composed of parents, no, who would help you out. So if you have questions like, is it normal for my baby to have this kind of poop, is it normal for my baby to have this rashes, so there are a group of mothers who are well experienced already who will also help you out. No, so that's why as a coordinator, no, you must be able to arrange, organize a particular community that would help your patient when they discharge or leave the hospital. Advocate for the client. So when you say advocate for the client, you act as the voice. You would represent the client on their behalf, no? So client advocate acts to protect the client. So we will be centering the patient care, addressing the patient's needs, and we will verbalize what is their opinion, what are their concerns. And also, the nurse may represent the client's needs and wishes to other health professionals, such as you relay the client's wishes for information to the physician. So if the patient would say, I don't want to undergo the procedure tomorrow, so you may be the advocate of the client and you will tell the doctor or the physician of the concerns of the client or the patient. So in behalf of the patient, you will be representing them as their voice. So that is being an advocate for the client. They also assist clients. Being an advocate, you have to assist clients in exercising their rights and help them speak up for themselves. No? So that is your role as a nurse. So another thing is that advocate for the best interest of patient and to maintain the patient's dignity throughout the treatment and care. So most especially if you'll be having a patient who is bedridden, GCS3 meaning comatose patient, so you have to respect still the dignity of the patient. So if you will be changing the diaper, bathing a patient, you still have to have that privacy, cover the patient, have a privacy, have that curtain, close the door, because again, you have to respect the patient, even if the patient is what comatose or Glasgow coma score of 3. No, that's how we grade it as comatose. No, so make suggestions in the treatment plan of patient in collaboration with other health professionals. So you can speak in the behalf of the patient and give what suggestion to the health providers or other health team in terms of what revision of the medication or delaying a procedure or advancing into a particular procedure. It depends on the scenario. So this is particularly important because patients who are unwell are often unable to comprehend medical situations and act as they usually would. So that's what I've told you earlier. If there's a patient who we have a patient who doesn't have that educational background, cannot understand the terms, no, or a comatose patient. So you will be be there for the patient to give out suggestions. It is the role of the nurse to support the patient and represent the patients and its best interest. No, so especially if we do decision making. So you will be there to support the patient, give suggestions, especially if there is a decision making that would be done for the improvement of the health of the patient. Role of other members of the health team in the health education. So by the way, in the picture, I have my whole team there. We have our doctor, nurses, our ancillary staff and auxiliary staff. This was during Valentine's Day, so we gave out plastic flowers, because flowers in the fresh flowers are not allowed in the hospital because of infection control purposes. So those are just plastic. Okay, so a team means a set of two or more people who interact dynamically, interdependently, and adaptively towards a common and valued goals, who have been assigned specific roles or functions. So that's how we define what is a team. So when you say team-based healthcare, this is the provision of health services to the individual, family, or other communities, but by at least two health providers who work collaboratively with patients and their caregivers to the extent preferred by each patient to accomplish shared goals within and across settings to achieve coordinated, high-quality care. So you have at least two members of the team who has the same goal and who work together collaboratively for the improvement of the patient's condition. So who are the members of the health team? So there's lots of members in the health team, no, in the hospital. So let's have it categorized first. So we do have here the core team. So when you say core team, this involves the following members of the team that are involved directly in the patient care. So of course, we do have the physician, we do have the nurses or nurse attendants, residents on duty, and physical therapists. So these are example of core teams who are involved in the direct care towards the patient. We do have the contingency teams. We do have teams that are, or committees that are being built or organized for a specific function. So we do have the Code Blue team, disaster response team, and COVID-19 task force. So those are examples. So when you say Code Blue team, if there will be somebody who will go on arrest, these is the team that you will be calling so that they would go to the scene and try to revive the patient. Disaster response, let's say for example there's fire, there's earthquake, no, there's flood, so the disaster response team would activate and would try to help out and solve the concerns. COVID-19 task force, for example, in our hospital, we formulated this team specializing only for COVID-19 concerns and problems. So if there will be a need to make a memo, there's a need for to revise the structure, to revise the process flow. There's a lots of things that we've done for the past 2 years because of COVID. So we do have the special committee or task force that will be composed of the different department heads in the organization that is being identified by the management, and we do have different tasks and roles to comply or to do. Ancillary teams or services, those are the laboratory department, radiology department for your x-rays, CT scan, MRI, ultrasound, central supply room, food and nutrition, no? Dietary, those that involves the dietary department, the finance, and the pharmacy. So those are your ancillary teams, not directly involved in the patient care, but they contribute to the welfare of the patient as well. So what are important values and principles of health team? There must be honesty amongst the members, no? A high value is put on effective communication within the team, including transparency about aims, decisions, uncertainties, and mistakes. So honesty is critical to continuous development and for maintaining the mutual trust, which is prerequisite of a high functioning team. So you must be clear, honest in your decisions. If there are mistakes, if there are honest assessments, you must be able to channel it properly using your effective communication skills towards the other health team members. There must be also discipline, no? So the team members carry out their own roles and responsibility with discipline even when it seems inconvenient. So such discipline allows team to develop and stick to their standards and protocols even as they seek ways to improve. So meaning if you're part of the health team, no, so if say discipline, you must be on time on your interventions that you do. You must stick to the policies and rules as well of the hospital. Creativity, the team members are excited and motivated to tackle emerging problems creatively. They see even errors and some anticipated bad outcomes as potential for opportunities for improvement. So this is when you would see how diverse, how creative your team is. Even if there's an error or anticipated risks, you would see how we will be able to overcome this or how we'll be able to address or approach this risk that is possible, that would be possible to happen. So how do we do it? So the team must be what communicating well and has that or have that creativity within themselves, no? Humility, being humble, no? So team members do not believe that one type of training or perspective is uniformly superior to the training of others. So you have to respect one another. You have to respect each of the team members' specialty, because if not, there will be chaos and there will be disorganization in your team. So you have to acknowledge, you have to respect the decision of every member of the team, because each of the member has its own specialized field. So you have to respect that with full humility. And what are the shared values, no? Shared goals. You must have the same purpose, the same clear aim, and that is for the good of the patient. Clear roles so that there will be no problem in terms of its functions and responsibility. Who does this? Who will do this? No, so that you will have a very good, efficient division of your labor, or for you to be able to meet your goals. No, mutual trust and respect. I already mentioned that. No, because everybody has its own specialty, has its own skills, so you must be able to have the respect to each of the members. Effective communication on top of everything. You cannot achieve your goals if you do not communicate properly. So this must be done consistently, accessibly to all of the members of the team. Measurable processes and outcomes. So meaning your goals and objectives, your processes and outcomes are, what can be done through a process flow that could be measured and could be tracked. You can you can have a system wherein you can assess it from time to time. You can measure it through numbers or through graphs or through a tool, no, that you'll be using so that you will be guided in all your decision making. So what are the benefits of effective team? So of course the benefit of having a good team, no, it depends. No? So organizational benefits, we do have the following: team, patient benefit, and benefit to team members. So it really has a varied, no, a wide benefit if we do have a good working team members, no. So for the organization, it will reduce time, costs of hospitalization, reduce in unexpected admission, services are better accessible to patients. So just imagine that, no. So that would reduce the cost of the organization if we do have a very good and working responsible health team. Team benefit, improve coordination of care, efficient use of healthcare services, enhanced communication, and personal diversity. For the patient, it would enhance satisfaction with care, acceptance of treatment, improved health outcomes, and quality of care, reduced medical errors because of very good communication among the team. Enhanced job satisfaction, greater role clarity, and enhanced well-being for the benefit of the team members of the health team. Let's go now to the last topic, which is the role of family in health education. So according to the Institute for Patient and Family-Centered Care 2010, the word family refers to two or more persons who are related in any way, biologically, legally, or emotionally. So the patient would define who would represent his or her family and the level of involvement each family member will have for the patient. So, the role of the family in health education is to provide thorough information of the patient information or details. So, the family member will also be an advantage if they will be there, who will be also helping out the patient during the course of the admission process, because that is where you could get relevant information, most especially if the patient is incapacitated patient who cannot read, who cannot say something, who cannot speak. So the information that we could get would be through the family members. Participate or assist in the patient care. So we need the help of the involvement of the family members, especially if the patient is really in a chronic disease or a bedridden patient. Then they will go home, and then what, they will continue the care. That's why we need the participation and assistance of the family members or relatives to the, what, bedside care of the patient. So let's say if you have a patient that is a bedridden patient, immobilized patient, or stroke patient who cannot move, so you will be, what, doing the turning to side. So how do we do it? So you need the assistance and help of the family member, especially if the patient will go home already, no. Another important role of the family member is the vital decision making. So any invasive procedure for that matter will be needing a consent form. So for the consent form, we will be needing, I already discussed that in the previous week, right? Informed consent must be done by the patient, but if the patient cannot do it, the family members, immediate family members, will give their decision, their consent for the particular procedure. I've experienced this a couple of times, no, in terms of patients who are incapacitated, who cannot, who are comatose, no, or stroke patient who cannot say something, or intubated patient. So they will be seeking for the advice or the decisions of the family member, and as a nurse or a healthcare provider, we must respect their decision. We must give them time to think, because there are families that are composed of, what, five siblings, and they, if some of the children are working outside, abroad, outside the country, then they will still have to communicate, talk to each other. So give them time to check or revisit things and weigh things as to their decision. no? So will they still be what aggressive in even if the patient is what no longer responding to or not responsive to the treatment already? So what will be their decision? So some will decide DNR, no, do not resuscitate, and that is very painful for them, no, if they would sign the DNR form, do not resuscitate, meaning you will not do any life-saving measures if the patient will come to arrest. No? So increase the comfort level of the patient. So of course, if a family member is there present during their duration of their admission, the family member would help them feel comfortable, would lessen. The next is decrease anxiety level of the patient, because the family member could give out support, no, full support to the patient, and then they will feel love with their family members. It's really different, no, if they will have the members of their family to be there actual in the bedside and just give them the support and love. That will of course decrease any pain or level of discomfort, and then they would feel happy, better, and they will feel that they can always anytime conquer any negativities during the whole duration of their disease process. So that's why it's very important to have the involvement of the family in the health education process. So with that, thank you so much for listening and have a good day.